you're like, I know the foundational, and you'll say it's boring. I get it. The foundational stuff, it's not sexy. But if you watch sports, teams don't run trick plays every play. They only do it out of desperation because they know they can't win off trick plays. They win off foundational. So for me, my 5 foundational stuff is: how do you eat, sleep, stress, exercise, and socialize? Those are your 5 foundational things. If you're consistent in there, and then let's say you're still struggling, great. There's supplements, there's peptides, right? There's other stuff. But those work best when you've got a solid foundation. And if you've got that solid foundation, usually you're not going to need a lot of that extra stuff. And if you do, it's going to be a much lesser level or later on in life than it would have been.
Hi, everyone. Welcome to this week's episode of the Sleep Like a Boss podcast. I'm Annika, Carroll, your host, and we're going to talk about one of my, I think, favorite topics when it comes to sleep, and that is sleep and brain health, because there is a massive connection, and so many of us struggle with loved ones having maybe Alzheimer's, dementia, depression, anxiety, whatever it is, and sleep is linked to that. And people with these conditions often struggle with that too. So I have an expert on the show today, Dr. Spencer Zimmerman, and I'm so excited that we're going to talk about functional neurology, functional medicine, and how we can keep our brain healthy and what it has to do with sleep. So welcome to the show. It's a pleasure to have you.
Thanks for having me. And I'm excited based upon everything we've already talked about before we hit record. So it's going to be fun.
It is. Should we dive right in? Tell us a little bit. How did you end up focusing your practice on brain health, and why is that your thing?
Yeah. So when I started school early on in chiropractic, and then I went to nurse practitioner, it was always like, okay, the nervous system's the master system of the body. It's like, okay, cool. So I really want to understand why, because I'm a really big why person. Now, as I started doing that training in neurology, I found out, I'm working out of this brain injury clinic, saw patients from all over the world, and I'd come home raving like, yeah, help someone else who's been struggling for so long. And my wife eventually says like, oh, it's not normal to have brain fog, dizziness, forgetfulness, all of that. And I knew she had some of it, but it had improved a lot with nutrition changes and everything else. And I was like, no, of course it's not normal. And she's like, oh, because I've got it. And so then I do my best little evaluation, and she does worse than the majority of patients who we were even seeing at our clinic. And it all goes back to car accidents she had starting at like the age of 13, and then another one and another one, never diagnosed with concussions. And a lot of it was just blamed on like, oh, you've already been to the doctor. There's nothing else that can be done. Plus you're a teenager going through puberty. So it's likely hormones, you're changing friends. And so a lot of her symptoms just got put on that versus it actually being her brain had been injured. So.
Wow. Okay. And then you could apply everything that you were learning to help her get better.
Correct. Yes.
That is great. That is phenomenal. What do you see? So car accidents, concussions could be something, but what are other big contributors that you see that negatively impact our brain health?
So we've really got to look and say, what ultimately drives inflammation? That's going to do it. Because we often think like, okay, well, I didn't have a trauma to my brain, so my brain should be okay. There's no physical trauma. But chronic stress, poor sleep, infections, lack of exercise, obesity, the ultra processed foods. Yeah, there's mold, there's Lyme, right? There's long COVID. All of that stuff can do it too. So there's a wide variety of things that can impact your brain. And basically, if you say, hey, when I eat this food, my brain goes to mush, guess what? You don't have an intact blood-brain barrier anymore, because food you eat shouldn't impact your brain, or else if you get seasonal allergies and it impacts you, same thing. Shouldn't make you dizzy. Stuffy, sure. Dizzy, no.
Why is that? Well, why would that be? Can you explain a little bit of what is going on in the body that causes this?
Yeah, so with your blood-brain barrier, it's basically this ultimate gated community, right? You should be controlling what goes in, what comes out of your brain. Now, when it's not intact as well as it should be, there's a lot of reasons it's not intact. You now start getting these inflammatory compounds from the rest of the body that are entering their way into the brain. When you drive inflammation in the brain, it's like throwing a backpack on someone that has 100 pounds of weight. I mean, like, hey, I want you to run as fast as you can without a backpack. It ultimately slows it down. When it slows down the connections within the brain, now you say, I've got brain fog. I'm just not as sharp. I can't process. I can't concentrate. And many other symptoms like that.
And so you were just saying there's multiple things that can cause the blood-brain barrier to become permeable, I guess would be the term, maybe.
Correct.
What's like a big reason that you see that could cause this?
So there's a variety, and I think we overplay what has to cause it. Yes, concussions, traumatic brain injuries, and strokes can do it. COVID can do it. We know chronic stress can do it, right? Enough sleep deprivation can do it. Environmental toxins and chemicals. Like there's multiple things that can breach our blood-brain barrier.
Yeah, and if we think about that, right? Like, because you just said chronic stress and sleep, and for me, that's almost because my clients, that's what they come for, right? They don't sleep. That's like, to me, that's almost sometimes the same thing. Yes, chronic stress can also be we go, go, go all day. We take care of everybody but ourselves, right? There's lots of jobs that we are working on. There's parents maybe we're taking care of. There's kids we're raising. But there's also this, if you don't sleep, that is a massive chronic stressor on the body, and the brain being part of the body, definitely on the brain. Can you talk a little bit about that? Like how a lack of sleep affects our brain health?
So many of you are probably familiar with your lymphatic system. We hear a lot about lymphatic. It's our waste removal system that's within our body. Now, your brain has a system where they call it lymphatic. Don't ask me why they just put a G and they just say like, hey, your brain's got its, but they call it the lymphatic system. It is most active when you sleep and you're going through the proper stages of sleep. So if you've got insomnia and you're waking up multiple times a night, or you don't go through the proper stages of sleep, imagine the garbage man doesn't show up. Your house gets stinky. That's inflammation. The same thing's true in the brain. You don't sleep, your brain ultimately becomes stinky, it becomes inflamed. And as a result, you now really are going to struggle.
Absolutely. And if that inflammation continues, because I'm somebody who's maybe really for years struggling with that. It's not I'm a parent, young parent, and it's a few months and it's kind of going to sort itself. But this is something more ongoing, or I'm cutting my sleep short because I'm just not putting a lot of emphasis on the importance of it. Over time, how does that inflammation like present, and does it develop into something? How is it a problem for people?
It absolutely can develop into stuff because when you have this chronic inflammation, once again, you've got your immune system in the brain and it shifts it from more of a reparative, restorative, let's clean up damaged areas versus a kind of more of a destructive, inflammatory. And for that reason, it's pretty well known that chronic sleep issues is a contributing factor to any neurodegenerative condition, whether it's Alzheimer's, other forms of dementia, Parkinson's disease. If you've got multiple sclerosis, you're more likely to have flare-ups. So, it's just not good overall.
It is not. And what would you say, like, how do I know? How do I know I have a healthy brain? I'm doing well. Or if it's easier to answer the question, what are signs of, oh, somebody's waving the yellow and red flags and something's not right?
Whenever we look at healthy brains have three things in common. They're fast. They are fast, right? They're processing information. Number two, they process it accurately because I don't care how fast you are if you can't do a task appropriately. And lastly, number three, it's cognitively flexible. So if you see a kid, right, who's developing, they're not flexible. You change the routine, everything goes. Or
Yeah.
you take someone who's got dementia, you change the routine and it's not going well. So it really gets thrown off. But the most important thing with the brain is you really got to be proactive, because the process that leads to any of the types of dementias starts 20 to 30 years before you'll ever get a diagnosis. And so don't play off like, oh, well, it's just common, yeah, I'm misplacing stuff more than I used to. I'm forgetting words. I'm forgetting names of people that I used to have. I've got to take a lot more notes than previously, or I've just got depression now. I've never had depression, but now I'm a 50-year-old and I've got depression. Like, don't downplay those things, because those can be warning signs of what's coming in the future. And so be proactive now, because if you wait till you've got dementia, there's not really a lot you can do at that point in time. It's too late.
And is it, if I have a few questions on that, because some of the things that you were just describing, like that person's name, just slipped my mind. It might come back like at some point where I'm like totally doing something else. I'm like, oh yeah, that was Frank, right? Or making lists. Sometimes I feel with women, and one being myself, starting to go through perimenopause, having hormonal changes. I personally too attribute some of that to the hormonal changes. I also sometimes attribute that to chronic stress, because if I'm super busy and I'm just overwhelmed, I can't think as straight. But if I have a few days of, you know what, let's just take it slower, it works just fine. Right? It's just, how can I kind of gauge that a little? Are there ways to measure this? Are there do you do assessments with people where you kind of question them, or you do certain exercises or tests with them to see, without going in an MRI or without doing brain scans of some kind, to see if there's plaque building or what there might be?
Yeah, so if we're looking at some of the best indicators of overall brain function, we've got to look at like balance. And
Okay.
I'm right, eyes open, but eyes closed, one foot in front of the other. Use a balance pad. What happens to your balance with eyes open compared to eyes closed? Because it's these reflexive systems really get impacted. Also, eye movements. We can pretty much map out the entire brain using eye movements. So how do you do when you perform a variety of tasks? Because people don't realize how well they do. For me, because of the practice I've got, 90% of the people I see, they think they do really well in their testing and they do horrible. But it's not till I show them the videos of what actually happened. They're like, wow, I had no clue. It's like, because our bodies compensate for us until it can no longer compensate. So let's figure out where it's happening, get it corrected, so that we can just kind of move on with life, versus waiting till symptoms have built up so much. It's like heart disease. First warning for a lot of people with heart disease is a heart attack. Like, don't wait for that. There's other indicators that you can find early on and then can address.
Okay. And so you would say, because if you're saying like with the eyes, we can map the brain, and I'm just thinking about like, how bad do you see like a trend? How bad is things like screen time? Like, we're on screens all the time. We're on phones all the time. Is that something you think might actually be a contributor to decline in mental health and cognitive ability?
Yeah, so there's been a term for about, I believe it's 20 years now, called digital dementia. So if you view your brain like a muscle, if you don't use certain muscles because you have other things doing it for you, your muscle's going to shrink. The same thing's true for our brain. So we knew, right, our house numbers, our friends' numbers, and everything like that growing up. Now, so many people, they can't even tell you their spouse's number or their best friend's number. They're like, I don't know, because they're over reliant on technology. And because we're over reliant on technology, we're basically telling those parts of the brain that had that functionality, hey, we don't need you anymore.
Wow. And yeah, that's so true. And I see my mother-in-law, who's almost 80 and is very sharp. Like, she has this. She's like, yeah, just give me the last 7 digits. Give me that zip code. I'm like, you're gonna be like you're going down the street. Yeah, that's fine. I'll write it down when I get home. I'm like, you're not going to forget that like 2 blocks down. Yeah, they're just she doesn't have a phone. Like she doesn't, she watches TV, but that's it. You're so right. Like training that. So if we're doing something like, I'm making it in our 40s, in our 50s, we're going either back to university to finish that class that we never took or that we're really interested in, or just learning something new, being it a cognitive skill, like I'm learning content to apply, or I'm physically learning a new sport, or I'm starting to go to yoga, we're talking about balancing, right? Those kinds of things. Is that then helpful for the brain?
Yeah, absolutely. Our brain loves new things. It loves it. It doesn't like mundane, reflexive things. When it's mundane, it's reflexive. It doesn't drive as much stimulation in the brain.
Okay. And do you and we've touched on this before, but I'm gonna before we hit record, I'm gonna ask the question because I think it's so important. Um, do you see a difference in men and women and brain age, like how they're aging their brain? Is there a difference? Is there something that women particularly we need to kind of be aware of, maybe?
Yeah, so when we look at the rates of dementia, specifically like Alzheimer's, 2 out of 3 diagnosed are females. And, we just see breast cancer, breast cancer, breast cancer. There's that month, like in the US, probably in Canada, it's every bit as crazy, commercials, all the major companies are doing stuff for it. Your risk of that as a female is 13%, which isn't anything to snooze over, right? But your risk of Alzheimer's is 20%. It's significantly more. So you've got to do things very proactively on that. So you really do have to pay attention.
Okay. So we were just talking about what we pay attention to. So things like I'm starting to forget names, I'm starting to misplace things. Is it like this? I walk in a room and it's like, oh my God, what did I come here for? Kind of thing?
Correct. You're looking at stuff like that and you're looking at trends, like if you're like, look, I've always struggled with names my entire life, I wouldn't worry about it. But if you're like, you know what, I've been good, but now in my 40s or 50s, I'm just starting to struggle. You know what? That's not normal. And don't fall for the, oh, well, we see this a lot now. It's like, well, yeah, but we see a lot of things that are still not normal, right? All the cancers, the heart disease, the dementia's going through the roof. Just because it's common doesn't mean it's normal. And so you've really got to, be looking at that. And the good thing is the majority of things that are contributing to dementias and especially mild cognitive impairment, which is a step before dementia, many of those are completely reversible. You just got to be proactive and identify what it is and then do it early on, right? You see smoke, go and figure out where the smoke's coming from. Don't wait for 90% of your house to be burnt down and be like, okay, who's got a plan now? It's too late.
Too late. So there's 2 questions I have about that. One, going back to this female 2 out of 3 cases, why do you think that is? What contributes to women having, because this is not that we're not diagnosing, that we're diagnosing differently or that we're diagnosing at different stages. I don't necessarily think. What do you think is the reason that women are just struck harder than men, or more often, not harder?
So I think one of it is hormones. So there was some research done where they were looking at age of menopause or those, whether it was regular menopause without surgical means or those that had surgeries. If you went into menopause under the age of 45, your risk of dementia was higher than those that went into it later.
Mm-hmm.
So hormones are definitely playing a role. The other thing is we also know females have a higher risk of cardiovascular disease. And if you have cardiovascular disease, that also increases your risk of different types of dementia as well. So I think it's that. I think it's also chronic stress. I think it's not putting yourself first. I treat a lot of females and they usually don't come in until they've been so ran down because they're so worried about everyone else.
Mm-hmm.
They're like, no, but I'm not going to be a good mom. I'm not going to be a good spouse if I'm not doing this. But it's like, you can only give to others what you actually possess. And if you're running at 70%, guess what? 100% of 70 is still 70. So you've got to do things to really focus on your health. And I think that's also a contributor.
Yes, I totally agree. Um, so what can we do? I know you even wrote a book, The Brain Reset, 7 Steps to a Healthier Brain, right?
Right.
What are things that you would say people on the regular should be doing to protect their brain and support an aging brain to age well?
It's the foundational stuff. And most of you are like, I know the foundational, and you'll say it's boring. I get it. The foundational stuff, it's not sexy. But if you watch sports, teams don't run trick plays every play. They only do it out of desperation because they know they can't win off trick plays. They win off foundational. So for me, my 5 foundational stuff is: how do you eat, sleep, stress, exercise, and socialize? Those are your 5 foundational things. If you're consistent in there, and then let's say you're still struggling, great. There's supplements, there's peptides, right? There's other stuff. But those work best when you've got a solid foundation. And if you've got that solid foundation, usually you're not going to need a lot of that extra stuff. And if you do, it's going to be a much lesser level or later on in life than it would have been.
Yes, and I love that you brought up that 5th one of socializing, because I think the pandemic didn't help. I think technology isn't helping. That we kind of often social personal connection, actually face-to-face connection, right, is really becoming less and less. And I think there's a lot that has shown, right, like that loneliness is a massive factor of people dying or people becoming depressed, and then from that eventually not having a motivation to be there, right? And I think it does, correct me, but I think there is a huge impact on brain health apart from depression, like dementia and all those things, if there is no social connection and no cognitive like stimulus with that, probably.
Correct. Yeah. UK, England, they've got their socialized medicine. So they've got massive data banks and they've been publishing. During the COVID lockdowns, it sped up cognitive decline. And after the lockdowns, it didn't actually get better. They did sink into depression. They also went towards alcohol. And even for those that didn't, they still didn't rebound because we are meant to be social creatures. But yet, with all this technology, we're like, oh, yeah, technology makes our life easier. It's ruined so much because we're not connected. No matter what all the commercials are telling you about, oh, look, with your latest cell phone, you're more connected. It's like, no, you're not. You're more trapped. You're not connected. We've got to separate what that actually is from a health perspective.
How bad is alcohol? Because for sleep, I'm always like, don't, like, it isn't, we know it isn't supporting you. From a general brain health perspective, what's your thought on alcohol?
I mean, there's a reason why when you have alcohol and they pull you over, they make you do brain-based testing because they know it damages the brain. It hinders the brain function. It shuts it down. And last thing you want to do is take a struggling brain and to slow it down further. It's going to drive inflammation. It's going to rip apart connections, and it's going to ultimately lead to faster degeneration.
Okay, so we're gonna stay away from that. You were just talking because we've used the word inflammation quite a bit. And I work on that with my clients when it comes to sleep too, because gut health to me is it is foundational for health, and everything you need to sleep is health. But can you talk about how you see gut health with regards to brain health, and how important you think it is to really look into that for people?
Our body isn't in isolation. And I think that's one of the worst things we've done in medicine is we've become so specialized that we ignore how everything connects, because ultimately the food you eat, right, the stuff that enters your gut, it's broken down. You've got these byproducts. They're either going to be inflammatory or not. It's going to hit signals to your vagus nerve, and it can actually go up there, create inflammation in the brain, or it can help your brain be healthier. But the other thing is when it does that, it now messes with the signals back down. And so that same vagus nerve that gets a lot of information from the gut is a very potent anti-inflammatory signaler through your spleen, but also helps you maintain your stomach lining. So it's hard to get your stomach fully back on track in your gut as a whole if you don't have a good brain. So you really got to look at it from both perspectives.
Yes, I love that. And I see it. And that was something I think I struggled with a lot when I had my burnouts and I wasn't sleeping, and then really focusing on, well, gut health is one, but really vagus nerve support, right? Nervous system support, getting into that relaxed state that I personally struggled with to get in myself for a long time. Like I still to this day do see a cranial sacral therapist regularly who just, when she does her magic, I'm just so relaxed. I don't even know how I could ever get there myself. It's fascinating how quickly we get so stressed and triggered from everything that's kind of flying at us all the time. It
Correct.
is. Can I ask you one more? Can we go like one little other direction still, because you're here and you're such an expert in this. There's one thing we've talked a bit about concussion, which is to me, well, being in Canada, hockey. I'm not a hockey parent, but a lot of our friends are hockey parents, and you see kids being hit in that all the time. Football, one of like these high contact sports, right? For the young ones, there's not so many, I think, in the adults, but you might just grow up with these. So the question I have is, how bad is trauma for the brain with regards to aging? And with trauma, I mean, yes, there's the physical trauma, and I've had car accidents and like that too. And then there's the emotional trauma that people go through that can be substantial. Is there a difference? Is it both bad? Can we correct some?
Yeah, so when we look at concussion, so they did a imaging study to look at the size of the brain responsible for memory, so your hippocampus. And if someone had concussions during their teenage years, in their 40s and 50s, that part of the brain was smaller compared to those without concussions. So it's not saying every single person that gets a concussion gets dementia, but it can increase the risk, especially when you have multiple ones. Your brain can shift into this more inflammatory state, which isn't good. But there also has been some research. Now it's kind of in the beginning, but they found even just doing high dose fish oils throughout a season helped to reduce the amount of damage that was occurring with these hits. Because you may not always get a concussion, but it's these repetitive hits, they do matter. So, and we also know in the military population, they found that those with IED blast injuries, and I'm not saying severe traumatic brain injuries, just concussions, their risk of dementia was double.
Yeah.
So, and then when we look at trauma also matters because it hijacks how your brain's functioning and it creates inflammation. It messes with processes in the body. And they've also done research looking at the severity of PTSD and depression in your 40s, and I think even maybe low 50s. The higher it was, the worse the cognitive symptoms were, and the more likely they were to end up with dementia as well. So these are both insults, and this is where we've got to really step back and say, what are all these insults you've got? And maybe your provider can handle them all, but maybe your provider's like, hey, I'm fantastic on this piece. And you come and find another provider who comes at the other side, because it's not just one thing. And that's where we really struggle in the world of dementia and chronic illness, is everything in the research is like, well, what's the one factor that matters most? And it's like, there's usually not one. I mean, sometimes there's one for that individual, but usually it's a combination of this is 40%, this is 20%, this is another 10. And it's dissecting it and figuring out your story to get your puzzle put back together appropriately.
Yes, you could not have explained that better, I think. And that is exactly what I see in my clients too, because people are like, why am I not sleeping? Right? It's like, yeah, it's a puzzle. For somebody, it might be gut health. For somebody, it might be nutrients. For somebody, it might be trauma or nervous system driving it, right? It's like you're saying, it's all so different. And you might need either somebody like you who can look at if it's about brain, you can look at everything, or really have a toolbox of practitioners, right? Where it's like, oh yeah, I'm working with that person on that, and I'm working with that person on something else. So if if we look at trauma, like emotional trauma again, is that something where you say people, yeah, we definitely have to support the system. We have to support the gut so the nervous system can calm down. And then are you looking into things like therapy, like talk therapy or EMDR or neurofeedback, or what would be things that you would maybe guide people to look into? Or is that individual?
So you've got to kind of look at the hierarchy, but before you do anything, you really have to say, who are the 5 people that get your most time and energy? They're not positive people. Get them out of your life. I'm sorry. I don't care if it's your mom, your dad, whoever it is. You cannot let them drag you down, because as I say, what are things that you can do? It doesn't matter if you have toxic people in your life. So yes, counseling can be great, but how often do you do something you enjoy? Like, do that as well. You know, Exposure therapy, like write down stuff, read it out loud. That's shown to have some benefits. EMDR, neurofeedback helps some. Transcranial magnetic stimulation can help others. I also do things like ketamine to help rewire the brain. Others are getting into plant-based medicines to also kind of do the same thing. But view it as kind of a hierarchy of like, start here, and then if that doesn't work, you can escalate all the way up. It's kind of the same thing with health. It's like, look, start with those basics we talked about, get your nutrition good, and then if that doesn't, there's stronger things we can go to, but it all builds off that foundation.
Yes, I agree. And it's really something I think a lot of people really struggle with. But we just have to, like, we'll put the work in now so we don't struggle in 20 years. Because especially with things like Alzheimer's, I just think it's like I'm seeing it in friends and family. It's just such a burden on the family. Why I think the person themselves, depending on what stage they're in, if it's advanced, they don't know really. And they don't mind. They're actually very pleased and happy people. But the family is giving up jobs to take care of them is really strenuous emotionally on the family. So I think we all have that responsibility to really take the best care of ourselves as we can.
Correct. It absolutely tears apart families. It destroys them. It's insanely expensive, 7, 10,000 a month for memory care units. Like, yeah, there's all this talk about, oh, save financially for your retirement. How about save health wise for your retirement, right? Like there should be like, this is your health savings that you're doing. So when you retire, you can actually retire. Because if it doesn't matter how much money you have, if you don't have your health, there is no retirement.
Absolutely. Trying to see if I have anything else. Is there anything that you're seeing right now, in research, in innovation, anything that's being looked at? Is there anything that where you saying, oh yeah, this is actually interesting. This is something that might have potential in the future?
So I think some of the biggest things, especially if we're talking about dementia, we're talking about sleep and everything else, it's the proactiveness. I mean, even the latest Alzheimer's drug they pulled it off the market here in the US. People weren't prescribing, it was too expensive. The results actually weren't that good, and some of the people quit their jobs when it got approved because they're like, this should have never been approved. So it's really that proactive nature, being aggressive and building that foundation. But yeah, you know what? There are some peptides that I do think are pretty promising. But if you're proactive and you take a well-rounded approach to your health, all of that stuff that's expensive and could be promising, you probably won't need anyways.
I agree. I agree. And it's really this, I personally don't think they'll likely will not be in our lifetime to save us from it. There was from dementia, there is not going to be anything on the market that there is no magic pill for health.
Correct. You're not going to regrow the brain. There's,
No.
I don't care how many stem cells, exosomes, everything you do. And if they do come out with something, it's going to be so beyond most people's financial abilities, hundreds of thousands, if not $1 million, that you'd be like, well, that's cool, but I can't do it anyways.
Yeah. Yes. Thank you so much. This has been great. Um, if people want to dive into this more, where can people find you? What can people read? What can people do?
Yes, I'm all over different social medias at drspencerzimmerman.com. If you want to read my book, it's on Amazon. And then I've also got a brain optimization guide on my website, idahobrainandbody.com.
Awesome. And we're going to link all that in the show notes. It's been an absolute pleasure having you. Thank you so much.
Yep.
And everybody, thank you so much for listening and watching. And we will be back soon. Thank you.
Thanks.